I'll be recording saying this.
Well,
I can't say that.
well, solutions we might take offsite. Welcome to the Medicare Cafe. We're on the pre-chat right now. We haven't been together in a month. I've missed you.
You're all dressed for winter, and I'm dressed for 100-degree weather.
You're in the right. It's office winter here.
Yep.
So whenever it gets really, really hot outside, the air conditioner gets kicking, and I cry a lot. Mm-hmm. And so versus like turning on a heater in my office, which I have done to combat the air conditioning, I just wear sweaters.
There you go.
It's office winter.
I like that sweater, actually.
Thank you. I also wear it because today I'm doing a webinar with Integrity, Ted Sims over at Integrity, to talk about all the updates, 2025 AEP, and talking about the MedSup market. So I was like, I'll get a little SMS branding while I'm there, while I'm at it, while I'm repping Integrity.
There you go.
But before we get in today, again, I know we have a minute before the cafe starts. Today we're talking about carrier partnerships. We did this pretty recently, but wanted to do it with the spin of like coming up AEP. Before we do, Carrie was telling me she literally walked out of an appointment, walked into the studio, and is just kind of coming down from like this situation, which I imagine a lot of your clients
I for sure had tears in my eyes.
The redetermination after COVID-19, the redetermination that happened last year, and everything that we're seeing again, a lot of people losing Medicaid status. You want to talk a little bit about that?
Yep. I had a dual client who was so awful. A dual client who was full Medicaid status, got a letter awarded that she now has a spend down of $220. And she tried to appeal it. She went to, Mo Health Net and was like, there's nothing we can do here. And then she got the letter from UHC saying she will be kicked out of her dual June 30th unless she enrolls in another plan. Mm-hmm. And she came in and was just like, what can we do here? I don't care what medical plan I'm in. I've never used the medical. I've never gone to the doctor with this, but it is paying for my $190 utility bill, my electric. And I had to tell her she was losing it. Like they're with her Slim B1 status, like there was no full dual that she could get. And she was just hysterical, you guys. It was so sad.
Yeah.
So sad. Said she's just going to have to go home and turn her air off.
And today's supposed to get like 95 degrees today.
She was just, but in the, not like, that sounds dramatic when I say it. Like it was the most like heartfelt, just like,
she's trying to process right then and
thing.
There.
And she's from England and has this English accent. So it was just like,
just heartbreaking.
It was just heartbreaking. I did get on Jarvis and was able to talk to the producer help desk, and she does qualify for a partial.
I was going to say they should have partials in here.
With her, but that has a $40 premium.
But does it have like utility benefits? Like does it cost
$60 a month utility?
Okay.
But if she has a $40 premium,
so you're just getting $20.
$20.
Yeah.
And but because she had LIS level 1, the premium's covered.
I was gonna say the premium, if she's on a D, or excuse me, on any level, you got it.
Partial.
Just depending on how much of the LIS, because a Medicare Advantage premium is actually 2 premiums switched into one.
Right.
There's health premium and then there's drug premium.
But they don't say that on the sheet.
No, they don't. The only place that I've ever seen that will see that, because you'll just see one premium. The only place that I've ever seen it where they actually break down, this is how much the health is, this is how much the drug is Medicare.gov. That's the only place that'll break down the premium.
Yeah. Well, Jarvis was super awesome. I mean, I gave that person a 5, and I really not rated anybody.
Yeah.
Really, she was fast. But anyways, so I did find out that she gets the $40 covered by her LIS status. But I mean, she was just so sad. And she was just like, I shouldn't complain. I at least have a roof over my head, which not everybody can say.
Oh, yeah.
Talking about moving back to England. And I was just like.
And that's just like, again, like people don't talk about that as an agent. Like, yes, what we talk about is the marketing, the business, the dollars and cents. But like the emotional, it's
how
like
helpless I felt.
Yeah, it's like honestly, it's like being a social worker, right?
For sure.
It's like being someone's social worker because they're in the situation, they're looking to anybody desperate for help. Sometimes you can help. Like today, you helped. But other times, it's just like there's nothing I can do for you.
Didn't feel like I helped at all.
I mean, you're getting $60 covered and, getting her on another plan. Like, I mean, there's absolutely a lot of help in that. So it like the emotional, like being an agent,
Sad.
being an advisor is a job that like you don't leave at the office. Like these stories
No,
come
that'll
home
stick
you.
with me for sure.
Yeah.
I was just telling Olivia something I wanted to do that I won't share on here because it's
Because
recorded.
it has been recorded. So we'll keep that in mind.
Yes.
But you did do, I mean, again, the fact that you care, that's what it takes to be a good advisor, is that you care. You could have just been like, you know what, sorry, you're off this. We can get you on another Medicare Advantage plan, and that's the case. But like, you said, okay, you're partial. Let's know my resources. Let's know what I can do to figure out how to give you something. And just go that extra mile. So that's why you're such a great agent.
Well, my empathy is too strong sometimes, and I felt like I shouldn't have been crying there with her, but I was.
Of course you were. No, again, and you're gonna get, again, like bringing it back to business and sense.
I have like glitter on my chin. I see it sparkling.
Out of all the things you could have said next, glitter on the chin was not what I was ready for. But guys, so again, it's we recognize it. We see you. We know you're out there doing the Lord's work. We know you're out there impacting someone's life, impacting how they receive care, their access to care, and like in this case, their access to clean food, water, and air conditioning.
Yeah.
That's huge. So today on the Medicare Cafe, after we all kind of like regroup and bring it back to business.
Yeah, what are we talking about? Because I didn't.
You were a
really
little
look.
busy.
I
Yeah.
was.
Today we're talking about carrier partnerships.
That's right.
And
you just said that.
Exactly. And like what to do. And this year is going to look really different because the carriers themselves, again, why carrier partnerships right now? AEP is going to be wild. You can use any and all resources that you get. Carriers this year especially are going to be motivated to be more engaged and trying to make sure they can squeeze anything they can out of a service area. The biggest thing here is that last year we saw a huge reduction in staff when it came to some of the major Medicare Advantage carrier reps. I know both Aetna and UHC, for example, both of them really limited and slimmed down what their sales force looked like. And a lot of these other plans this year, who are smaller regional plans, just don't have the rep footprint that those big name brand carriers can have.
I honestly don't know right now. I couldn't tell you the name of my reps. Couldn't tell you them.
You should take to. That's why we're talking about this now.
But like, how do I find that out?
I'll tell you. I can tell you who your reps are. I mean, that's why, again, we'll get into solutions. Okay. We'll get into all of that. But now is the time to do the research and to build those relationships.
On my AEP to-do list.
And
we need check to it off today.
We need to share it. But for real. Okay, but for real. A lot of these reps are brand new, right? So like saying like I don't know who they are. Most of you probably don't know, or maybe we just got word yesterday of a few more. Some of our favorite reps are retiring right now, right before AEP, or this will be their last AEP. So it is. I mean, a lot of reps are moving. It used to be a lot more fluid to where like you could follow a rep and they just kind of went everywhere. We've seen this year and in the past couple of years that reps have been pretty static up until last year. Whenever, again, a lot of carriers changed their service model to eliminate reps. So it's really, really important. Now is the time to do so, because if you wait a few more months or maybe even a few more weeks, you might be out of luck. It might be too late. So get to know your reps. We're going to talk about like some things that they can do for you.
Tell me who mine are.
What you can expect for them, things like that. Let's get into it. So number one, what is a reason for having let me try again. What's a good relationship?
We need to have relationships with our reps, because one thing we need to do, and I'm going to do for the first time this year,
I'm really excited about that.
ANOC.
I'm really
an ANOC meeting. I'm going to do it, and you're going to walk me through it.
I am. Okay, so here's
and I'm going to make rhymes.
I'm going to walk you through it. The reps are going to walk you through it. Here is why I think having a rep during these sales events. Okay. My brain.
Just slide back up. Just read it.
My brain is saying, girl, why are you even trying today? Today's my son's 4th birthday.
Oh,
so I'm a little distracted. And I'm coming off of a birthday party and our charity tractor pull last weekend. And so like my brain hasn't quite been like, we do insurance. We do insurance here. So, okay.
Your name's Olivia.
Thank you. Oh, God, I need the reminder. So, This AEP is going to be nuts. Statistics are showing an increase of about a 70% shopping rate compared to the 12 to 15%. Carriers are expecting about a 25% drop in their benefits this year, and 90% of beneficiaries are expected to see a negative impact on their plan. Which means, I nailed it. Which means that it's going to be more important than ever to see as many people in a little amount of time and work on your efficiencies. AEP events like ANOC meetings, sales events, things like that are going to be really important to see as many people and just kind of like do group appointments.
Yeah.
Those are really awesome to have when you have a partner like us, for example, but to have the carrier rep there as well for several reasons. One, the carrier rep will oftentimes give you the ANOC information as the consumers are getting it, because agents don't get ANOC details. They get it, they have to either get it after October 1st or have to get it from their clients, right?
Right.
So agents don't automatically get privy to the information, but the reps can get it for you. On top of that, the reps can also help you do these events, register them for you, give you the information,
That's
give
huge.
you the materials that you need for it, to where you get to focus on, like, events can be really time consuming and they can be really busy.
Oh, yeah.
So to kind of pass that off to somebody who has a vested interest in your success, because again, these local reps don't make money unless you write their apps. So they have skin in the game to help you write more of their business. So use them, use that extra resource and offload some of that, I would say, desk work, like registering events and getting those ANOCs to your local reps.
And so remind me, if I have to register my ANOC event. Do I do that on UHC's site, on Humana's site, or do I do it through my local rep?
Every carrier does it a little bit different. However, every carrier does have it done through their portals.
Okay.
But if you just contact the rep, they'll do it for you.
Okay. Done.
Because the
That's
portals,
way easier.
again, it can be really complicated, really confusing. You have to worry about how you register it, the contact numbers, all of that. The reps will do that for you.
And they'll come to my meeting with me.
If you want them to, and if they're available, which is why it's important to get your ANOC scheduled now, get your sales meetings scheduled now, and talk to your reps now. Because if they have availability, they will. And if you're somebody, I know this doesn't apply to you, but if you're somebody who's really uncomfortable with public speaking, those reps will oftentimes do the event for you.
Yeah.
And then you get to reap the rewards. So it is really important. Again, but you got to get there now because there's fewer reps out in the world than there used to be. So make sure you're building those relationships now. And now keep in mind what we might be used to, especially if you've had a relationship with reps in the past, is that oftentimes reps will pay for the events, they'll fund the events, they'll do a lot of extra marketing activity for you, advertise them. That's going to look a little bit different this year because, again, we can't do a per app basis. You can't pay extra money to entice your business to be written. So you may not get the funding, but you do get the support and things like swag, pins, things, that are that company branded.
And remind me, for a registered, because I've always done educational. So for a registered sales event, I could have coffee and like donuts, right?
The only thing you can't do at a registered sales event is you can't provide a meal. You can't have a meal there.
I've never done that even at an educational.
Yeah, you can't do a meal, and you can't make sure that you're spending more than $15 on average per head. Yeah. Right. And so that could mean that you're giving out snacks or like little gum tchotchkes that are $15 a person.
Some what? Gum tchotchkes?
Or some tchotchkes. I'm struggling.
I don't know what that is.
Tchotchkes?
I don't know what a tchotchke is.
You know what a tchotchke is? Does anybody else know the word tchotchkes?
Don't know that.
Tchotchke is like swag.
I need to take a picture of what Michelle
she can also check to see if one
about my LAS.
Yeah.
Yes.
So.
Michelle, yes.
Yeah.
About the time I hit send.
You're answering my question about the time I hit send. You're funny. Yes. But yeah, so tchotchkes are basically like swag. That's like the 2020 version of it. It's called swag. But yes, well, it's 2024. It's not 2020.
It's a hard day.
I'm not doing well. And that's
call it quits. Go pick up Cade. Have an awesome
just
4th
have
birthday.
A great day. Except for the fact that I have this Integrity 2025 AEP webinar later on today.
Just leave after that.
Anyways, so we should be good. Again, let's move on to the next point.
Slide. What's the next slide?
Potential leads. Again, especially those carriers that have both PDP and
Oh.
Medicare Advantage. There is a lot of emphasis right now on exchanging your PDP clients into Medicare Advantage clients. When it's a call center lead or a lead that's designed to go to one of their call centers and they're either aged out, especially carriers who are more or external distribution friendly, those overflow of leads oftentimes go to the local reps.
And they get to just pass them out.
And those local reps get to pass it out to, honestly, I mean, like, whoever they want to in
pass
most
out
cases.
the tchotchke to who? Is my saying
A
it right?
tchotchke is a small, cheap
Ornamental trinket or souvenir. A knickknack.
a trinket. I like the word trinket.
Mm-hmm.
Trinket.
I know trinket.
I'm for sure forever swag and tchotchkes are
Or
now
trinkets.
trinkets. Oh, it kind of tickles.
Or a knickknack.
Nope, trinket it is.
Trinket.
Ew, I don't like it. I think I like it. It's kind of like when a tooth hurts, but you kind of like mess with it to see if it still
Oh
hurts.
gosh.
I don't do that either. Anyways, so yeah, making sure those reps, they do have skin in the game. They do have success. Like, they don't receive bonuses and unless they hit their quotas. To hit their quotas, you have to write apps. So they're going to give it to the people who they believe is going to write that
Yeah.
business. And honestly, the people that
And if they don't know you, they won't give it to you.
Exactly. So if you're interested in receiving some of those, make sure you reach out to your local market rep. I know you have a hard stop at 10:30. The second to last one I believe I have on here is escalated issues or support.
Yes.
Now, here's the thing. If you have senior marketing specialist, then you don't have to worry about that. Like, if your contract is with if your United Healthcare is with us, you don't have to call United Healthcare. You don't have to find your local UHC rep. You just call us. But like, if your Aetna is with another partner or with another FMO entirely, then yeah, it is really helpful to have your local market reps information, because when an issue is escalated, especially during AEP, because like during AEP, the carriers are bringing on temp. So many temp people.
Oh, yeah.
Oftentimes they can't handle the flow of how many calls they're getting, so they'll send some call centers offshore. So the people you're talking to today are likely not the people that when you call up October 15th with a question, you're getting a person that's just following a script.
I had our old UHC rep help me immensely with, again, it was another dual. I don't have many duals, and the ones I do are a lot of work, and like there's a lot that goes wrong.
There tends to be, yeah, that's fair.
But yeah, he helped me immensely, like escalate something, and I just texted him, and I was
Raggy?
Yes, I was so
We love
grateful for
Raggy.
Raggy.
Raggy is now with
So
Essence.
grateful. I know.
So
I know.
that's a
I
good
miss
one.
him at UHC.
Yeah. So, but yeah, no, it is. It is because they know the ins and outs. They have the contacts. They have the people to go to. Now, to be fair, and in the case of Raggy, I'll give him the shout out that he deserves. A good rep makes all the difference.
For sure.
There are certainly not all reps are created
No.
equal. They are employees. They are people just like you and me. So like they, so I mean, like, just if you find a good one,
So like,
use 'em,
was this
love them, buy them coffee.
One thing that I loved about Raggy is he was always proactive about like setting up meetings with us to find out what we're doing, what we like, and meet with us before AEP to where kind of give us sneak peeks. But like, no other rep from any other carrier has like ever done that.
That's pretty unusual for a rep to reach
okay,
out.
so that was unusual.
Yeah, it is unusual.
I just got spoiled my first 4 years doing that.
It is, and keeping in mind
I just
too.
hit my 5-year anniversary. this month.
Congratulations! That's awesome. You've built so much in 5 years.
Yeah.
But keep in mind, with your case, you're working with a huge agency, right?
Yeah.
So he's
Right.
not coming to talk to Carrie. He's talking to
Yeah.
talk to the agencies that Carrie's working
But he'll
with.
like personally call me
Of
and
course.
ask like
Of course.
he knew my strategic partners, like that my model of business. So like I feel like
It's very unusual.
Okay.
It's very unusual that an agent doesn't have to be really involved with building that relationship.
Yeah,
Because
okay.
especially now, whenever you have one person who used to be in charge of St. Louis, used to be in charge of Denver, used to be in charge of Dallas, their territories have gotten huge. So instead of having 700 agents that they have to work with, they now have 2,000.
yes,
So
they could not do that.
So it's all about, you just need to be loud and need to be rememberable. Memorable? There's no re. It's just memorable.
I'll be
So again, so just keep that in mind. And again, reminder that they do. Oh, it's really important to remember that the reps are on your side. They have skin in the game.
Yeah.
You know, compared to a 1-800 number or a person who is just in a call center for a carrier.
Yeah.
They have skin in the game to make sure you're successful and make sure that your systems and processes are friendly with theirs and
got my escalated issue done. Actually escalated.
Yes.
Like fast.
Yes.
Which
Very
I feel like
helpful.
wouldn't have happened on the 1-800 number.
You're probably right.
Yeah.
Now, to answer your question, Carrie, you kind of been talking about this, like how to connect.
Yes.
So number one, call us. Even if it's with a contract you don't have through us, we will tell you who your local rep is and oftentimes even make the introduction. So please call us. We're more than happy to get those meetings
Does
set up.
that mean me or
Absolutely.
SBS?
No, we'll get you set up to tell you who is your rep,
Okay.
what is their contact information, everything in between. Now, the biggest thing, like I said, is that these people who they're in charge of and what they're in charge of has grown exponentially in the last year and a half. So, you know, it's I think a lot of agents get the understandably so, get the thought of like, they should be working for me. They should be calling me. They should be taking me out to lunch. They should be, you're not wrong because again, reps aren't necessary if agents were in the field. You're not incorrect. But that's not necessarily the case anymore. And at the end of the day, you need to be investing in your own success, investing in your own future.
Right.
So go buy them a cup of coffee. Go take them to lunch. Go give them a call. Don't wait for your phone to ring with them because it's not going to happen. Reach out to them, become memorable to them because at the end of the day, you're the one that's going to really benefit off that relationship.
I hope there's not a bunch of turnover this year.
I haven't seen... Last year was pretty unprecedented.
I feel like I remember the rollout meetings last year, and it'd be nice to like at least if it was the same people.
The people who did your rollout meetings last year should be the same people that do them this year. Which goes to that last point. Go to any and all meetings, especially the rollout meetings. This year, again, a lot of agents
get better at that, at like introducing myself to them.
Yeah, go and talk to them. Go and say hi.
Yeah.
Go and say like schedule a meeting with them from that event. Say like, I have this. I'd love to meet with you. Now understand too that like. Again, like our local rep for us has to come from St. Louis. So it's not just calling Raggi and being like, hey, let's go grab coffee. Like it takes a little bit more planning, but they are in the area quite often. So it takes a little bit more planning, a little bit more finesse right now, but make the most out of it. If you're going to go to those meetings, you should go to those meetings. Build those relationships.
I'm not going to wait though because that's too long.
It's those. Okay, here's.
I'm not going to wait to meet them at the rollout.
Because those rollouts aren't happening until.
I'm going to email my reps.
Good.
About my ANOC
Are you?
Yep.
Send me screenshots.
Just put it on my to-do list.
Send me screenshots. I want to see.
Well, I'm going to email you to connect me to them first.
Oh, okay. I'll send you screenshots. But no, it makes the biggest difference because a lot of agents are talking about like, you know, we know with this AEP with the rebids that rollouts. We've seen Devoted, we've seen Cigna, we've seen I think one other company has come out with this is what our plans are going to look like in 2025. Those are essentially worthless because they're not going to have anything specific because of the rebids are just so wild west. We don't know what's going to happen. It just gives you the vibes. That doesn't make those rollout meetings any less valuable.
Yeah.
Hopefully by the time, you know, late August, mid-September, we kind of start to see more realistic about what those plans are going to look like. That's so your rollouts are going to be probably later in the year than what we're used to. But even if you're just going to, again, I know there's a ton of webinars right now about DSNP. Or not webinars, there's a ton of trainings about DSNPs, a ton of like meet your local reps. Do them. Go them, get the free coffee and the pastries, do what you need to do, but take the opportunity, even if they stand up there and tell you and sing Yankee Doodle Dandy versus actually telling you what the plans, go meet your reps. It is 100% worth it and you'll be rememberable just because it's memorable. Why do you keep saying rememberable?
Flows off the tongue, maybe.
It doesn't. Well...
This is kind of on topic, but off topic, something that crossed my mind. So, speaking of events.
Yes.
I am, the month of September, I already have 2 events scheduled each week.
I love it.
Like seminars that I'm giving. And I've kind of been second guessing, like, why am I doing them all in September? But I just wanted to leave AEP open for meetings because I'm scared of how crazy it's going to be that I'm already not going to have as much time. But, like, it sucks that I'm not going to be able to, like, talk about anything. Yeah, because keep in mind, to your point, you can't talk about 2025 benefits until after October. Right. Well, I mean, I won't know anything. You won't have anything. So what you could do. But I don't want to wait. I don't want to have. I mean, I have eight presentation scheduled in September. I can't do them all during October.
No. What I would do
So
with
like,
those...
am I wrong in my strategy here?
There is nothing. I'm going to say this. Anybody who's going to be I'll say it like this. The loudest will win.
Yeah. Okay.
I don't care if the information...
They're hearing from me first.
Value, I have an emphasis in psychology, which means absolutely nothing. But I do remember there is a thing called like, you have to overcome first impression, like why first impressions are so important. There is something that even if you hear it for the first time, like the example was like firefighters, what was it? It was like, firefighters have shoes that are lined with lead. That's just how firefighters work. You hear that from a source that you feel like is reputable. They can come out, if you hear after that, no, firefighters, they're lined with rubber, they're not lined with lead. You have to be proven wrong because what you first heard. Yeah, you have to prove that wrong. People tend to believe and understand and like what's first.
Yeah.
So that's a really long explanation that nobody cared for, just to say being first is really important.
Okay.
Being the loudest, to stand out during an election year,
Yeah.
to stand out during what the carriers are going to be going through, to stand out over social media, the loudest will win.
I guess that's what I was originally thinking is like, it's close enough to AEP, so it's on their mind. It'll be fresh. They'll hear from me, and then they'll remember, okay, it's October 15th. They'll have my contact information.
Right. We're telling a lot of our agents to do their appreciation events in September.
Yeah.
And
a lot of these are like companies that are asking me to do annual talks.
Yes. And that's huge.
And so... I think September's a good time for that.
The reason why we're telling people to do the appreciation is because a lot of agents, understandably so, are really uncomfortable with not doing like the warm pleasantries and like, let's talk about your upcoming vacations, how are your kids doing? Because AEP appointments are having to get cut down to 0 time, 15 minutes, 30 minutes tops, right? And so they're like, but like my clients, like, out of the way. I don't want them to feel offended because I'm not wanting to talk about their blueberry pudding recipe. And it's like, no, you do the appreciation events, set the expectation, like this AEP is 15 minutes, we'll get in, get out, but like you build those relationships, remind them of you during the appreciation
I wonder, okay, sorry to be, I don't know what the word is here, impolite to men, but we are just way better multitaskers.
You're not wrong.
Way better multitaskers.
Oh my, yeah, I firmly believe that.
Like, I will toot my own horn. I am so good at like doing apps while I'm talking about the pudding.
Yeah, while I'm talking about the pudding. Yeah.
Like who was I talking to? I'm on a team with like 10 guys, and it came up at some point. Are you the only girl in
your team?
It came up at some point that I'm like, how do you guys do your job without multitasking constantly?
Yeah.
But they're like,
Can't do it. Of course you can't. Of course you can't.
It's just funny.
So again, make sure that you're doing the most with those. And I think that's something that you mentioned here is like educate them on your agency. It is really important that you emphasize to them that like you are a true advisor. You're not just somebody who's going to enroll them and leave them, because that's the whole reason for all these rule changes is because looking at membership, not looking at enrollment, right? Looking at what does a person get the other 11 months out of the year versus the month that you enroll them in that plan from you being your agent. So really educating them on your business style, your marketing techniques, and seeing how can we work together to fit in your product and to fit in, where do you guys fit here?
Huge. Do it this week.
I want to know how it goes. Tell me about it.
I will.
That is what we have today for the Medicare Cafe, talking about how to make the most out of those carrier relationships. If you haven't in the past, this year is the time to do it, and this month is the time to do it. Build those relationships today. Now. Get off here right now. Go call a rep or call us, and we'll tell you which rep to call. Because I think there hasn't been a ton of turnover this year. Last year was the year of turnover because all huge carriers just laid off a ton of their people. But they're pretty much stable this year from what I've seen.
Good.
Any questions, comments, concerns, threats, or promises?
Oh, I'm seriously taking a picture of what Michelle said here.
Thank you, Michelle.
Thank you, Michelle.
And you have a meeting.
Sorry, I just got up close and personal. I do have a Zoom meeting that I will be taking right here.
Perfect.
With my blue background.
You guys, we appreciate you all.
Just got way up close in the camera there.
We appreciate you all so very much. Any questions, comments, concerns, thoughts, or promises, give
Send
us a
them her way.
call. That is my phone. You can text me or call me. I do have a webinar today at 1 o'clock Central Standard Time with Tim from Ted Sims from Integrity to go over the 2025 IRA, to go over the changing in the bid process, to go over basically everything we've been
Good
talking about for the
information.
last 2 months.
Yeah.
So
Yeah.
awesome. So until next time, guys, have fun
Make money
and give impeccable service.